On the theme of improving patient outcomes, let us now move forward understanding behavioral aspects of metabolic health. It is now my immense pleasure to invite Dr. Subhash Kumar. Dr. Kumar is the Director of Diabetes and Obesity Care Center in Patna and brings over 25 years of clinical expertise in diabetes and obesity management. He is a SCOPE certified obesity expert from the International Obesity Federation and has served as faculty in international diabetes education programs. Today he will share his insights on core behavior modification concepts in obesity. Please welcome Dr. Subhash Kumar.
Good evening, everyone. At the outset, I would like to thank the team CardiacCon for inviting me to this session. Actually, after such an insightful session on the core behavior, the very high-tech science of medicine, we are moving to some basic skill of diabetes and obesity management. So my talk is on core behavior, which is just let me share my slides if at all. Just taking some technical, just a second. Yeah. I must thank a team for taking this topic because it is hardly discussed, I believe, in several meetings, and it is going to make a big change in society once we discuss this topic to tame the obesity and metabolic disorder. We understand that obesity is coming up a very, it is a core problem in our metabolic disorder, and it is coming up very dangerously to all the age group. I would say particularly the younger generation. We are labeled now as the second highest population in world in terms of pediatric obesity, or younger generations are becoming more and more metabolically involved. They are also getting detected with the almost all syndromes of obesity now, starting from diabetes, hypertension, coronary artery disease. So this is a very dangerous issue which we have to face in coming days, and we are facing today itself, and it is going to be a very critical for our public health system also. And it has been seen that the core behavior which we learn from our childhood is the basic mechanism for obesity, along with its genetic and epigenetic factor, where we have to start early. We have to make the society aware of this demon from the day baby is born, or the day people are seen in OPDs. And understanding these trends is crucial for implementing effective intervention in terms of not only the pharmacotherapy, but it should be from the beginning of your treatment plan of the patient. So the key contributor, which we know that it is diet, it is inactivity, stress, which is very important, and which is one of the reason for young generation getting trapped, and also sleep deprivation due to the newer technology and screening time and so many other factors which are related to this issue. And it is not only these obesity factor, it also have an important behavior which we learn. So understanding behavior modification is very crucial in terms of addressing this issue. And if we know, unfortunately, our medical college days or our teaching was not meant for teaching these behavior techniques, and we have never emphasized on these crucial issues in medical college days. It is only lately the government and the teaching institution have taken up this issue of how we can help people in terms of changing their day-to-day living behavior and also toxic behavior which is there. So by implementing this, we can make a big change in terms of not only obesity, all other issues related to addiction or related to metabolic syndrome. And this is the way we can take long term preventive issue, as well as, if at all, we do have pharmacotherapy which is very effective now, but we cannot continue it for a very long time. So we have to build up these therapy at the base of these behavior changes which a person need to take up. And we need to understand how do we conduct these behavior changes. And these core strategies are starts from the day of self monitoring, where you can teach people how to track their day to day eating patterns, or also just monitoring the weight and glycemic parameters which is at home based. Triggering identification, very important, because everyone has its own trigger to have some behavior changes, maybe eating pattern, maybe something like if you take smoking, alcohol, or other factor, there are some triggers which they have to find. They also need cognitive restructuring. So we need to learn about cognitive behavior therapy also, in terms of knowing what is going on in their mind, and how they can keep this thing on right track. Shifting mindset towards healthier choices are very important, and these needs some of our responsibility for people to understand and infuse in the mind of people that what are behaviors which they need to learn, because we may have so many other wrong concepts in our mind, and we have to help them. Goal setting is also important, because we jump immediately to people with all the best possible outcome, which is never realistic. And we need to understand that it is also have a realistic goal setting which is important, and sustainable pattern where a person can reach to a stage where they can have these behavior changes lifelong. So this is a generalized statement where there are people with several other behavior disorders, or you can say toxic behavior which they have. And treating obesity, treating diabetes, and other factors need these important five core strategies which we have to understand, and we have to teach people. So understanding framework of obesity intervention, especially when you talk, these are dynamics which can help practitioners design effective strategies that promote sustained life changes. We cannot do just everything in one go. We have to understand that behavior changes takes in steps, and before teaching other, we need to understand how these behavior changes. And this is the core part of behavior modification. And you can understand these changes, or the behavior changes, through these important five factors, which are social cognitive theory, which we need to understand. Unfortunately, we have not gone through it in early days. Health belief model are also very important, because every society had its own way of thinking in terms of health beliefs, and there are so many misconceptions and things which are very risky for them, but they don't understand. Also, there are self determination theory, and very importantly, James Prochaska's trans theoretical model of behavior change, which we have to understand before we are going to advise anyone with any kind of behavior change. Because this is a common mistake which is done every time when we jump and talk people, when you want to change someone's daily living style. And also importantly, especially in our part of world, where we have never been in terms of motivational interviewing, it comes only with the long experience. But people and the young generation should pick up it very early, because unless until you know how to interview a person with obesity, person with diabetes, smoking, and other toxic behavior, you will not be able to help them. And if they are not changing their behavior, it is not their mistake, it is our mistake, we are not helping them in terms of how do we change. So to start with trans theoretical model of behavior change, the theory says that no behavior can be changed in a one day. One person has to go through cycles, or through the stages where they have a different mindset, and they are different thinking, and there are different issues with them. And understanding these stages where the patient is when he's in your OPD, you can help in many ways to understand that how you can help in terms of changing. These stages start from a pre-contemplation, contemplation, action, maintenance, and contemplation. I will go briefly in these stages to make you understand that these stages can help people understand, and every stage needs a different intervention. So you know that stages are again step by step. We have to recognize when a person come to you and how he's going to be in a stage of different stages, like in completion stage, where he is not able to understand any risk behavior. Suppose if a person is diagnosed with diabetes, or you see that he is very obese but he is not understand, the family is also unaware of it, and you are trying to tell him all the side adverse effect in long run, but he is in a stage of pre-contemplation, so he will not be able to take any of your advice because he doesn't have any understanding of the risk which he has. So in this stage you need to make him understand what are the risks, and how do we what are his ideas about it, and you need to give him time to absorb the fact that he is suffering from such a problem, and he needs help in terms of uh, the lifestyle modification, because he is a happy user of his daily routine and he doesn't want to change in his life. So once he has understood that okay, there is something wrong in me and I'm not doing very perfect in my eating pattern or my exercise routine or my other habits, so we need to change. So now he has shifted from the pre-contemplation to contemplation stage. Now once he has realized that he has a problem, but he starts evaluating, there will be ambivalence in his mind. He will be thinking, okay, how can I change? These are very important things which I want in my life, and these are the things which I cannot skip. So he will not be very happy to change, but he will be at least having some mindset that he wants. But if you have helped them further, he will change to preparation stage. Now he thinks, no, I need to do something to change my life. Suppose wants to start doing some exercise, or he wants to change his eating pattern, he wants to stop all those junk food. So he will start thinking, and he'll make a kind of determination in mind that at least I need to change. For example, like for going to a gym or a walking schedule, he'll buy a shoes or some preparation for seriously thinking of changing. So this is a preparation stage. Now he moves to the next stage of action, where he has been starting, he has been doing a baby step and moving forward for his behavior change, like doing some kind of exercise, or at least avoiding those food which he was not supposed to take, and some changes in their day to day living. And once he has taken some stage further, he has learned the behavior gradually, and he has reached to the maintenance stage. And now the stage where he has been doing it consistently, and he's avoiding all those toxic behavior now, or behavior which is not healthy for him for some time, and he has learned it finally. So a person which comes to us in our OPDs, he may be in one of these stages, and we need to identify them. And now once you have identified it, you can help in terms of moving to the next step. It is not that once go you can do all these changes. And now when we talk about motivational interview, again this is something which is very important, because any advice should go not from your side to the patient, but it should come out of patient's will and desire. And how do we do this? This is again a patient centric approach, where you have to collaborate and counsel patient, and you have to bring out of patient will and desire that he want to do such changes. So for that, by actively listening is very important. Unless until you listen the patient's perspective, you cannot give advice to him. So clinician can help individual exploring their the doubts and ambivalence which is there in mind, suppose in terms of weight loss, in terms of diet pattern and other things, making them more clearly to adapt a healthier behavior. This approach can support environment for promoting sustainable lifestyle. And when you talk about motivational interviewing, there are again 5 important points which we need to understand, which is really important to imbibe in our behavior or to learn the new generation about these things which we hardly do in early stage of our clinical practice. This is showing empathy to the people, and having something which is not sympathy, it is something that should come. You should put yourself in patient's condition, and you should be able to show the person that you also understand the emotions and the stress which he is going, or the problem which he is facing is the same which you understand. Once he realizes that that my doctor is also understandable of my conditions, then he can also think that he will be able to he will be able to understand your thing. So same way, discrepancies should be highlighted, that what are there in their mind: resistance, efficacy, and autonomy, which is very important, because everything patient has to decide, and you need to help him to understand about this. And unless until the patient takes the decision, he will not be able to adhere to it. So very importantly, that you have to have open-ended question, affirmation before whatever you say, you confirm from the patient side. Active listening is key to behavior modification and motivational interview, and at last you summarize that what he is thinking and what he wants and what should be done, so that he can have clarity in his mind to understand what all things he had to do in coming days. So enhancing patient engagement is very important. It is not that we jump and decide everything for the patient side. You have to give time to the person to understand, and he should come out. It may take 2-3 settings, but it will be effective. It is not going to get at one go. So what all things which we need to do weight loss, when you want to we have to understand all this behavior, we have to ultimately have a meal planning, stimulus control, support system for people, because families are the big issues where they think that weight loss is a problem, and we have to make a supportive environment, and self monitoring is very important in terms. And now we have a digital era where there are several apps and wearables which can help people to understand and monitor their behavior. These are really very important and very the best way to go. So for just example, say you can take a picture from chat gpt and get a calorie calculation of your meal, or you can teach them that how much calorie he is consuming, and every time he can go through it and understand how they are doing. So these are the clinical takeaway from that. Behavior science is something which need to explore and understand. We have not gone very detail in these science, but there are something which can help. If you think that patient is not following your advice, always think it is not a patient's failure, it is our failure that we are not able to help them in terms of understanding his problem. And it should be done in a stage based manner. You cannot go in one go everything. There should be a way of motivational interviewing, and follow up and continuous support is the one which is very basic to have these important factors. So I want to thank for this opportunity, and hope to see you soon, Dr. Ashutosh, and all the team which I am missing today. Thank you. Thanks a lot.
Thank you, Dr. Kumar, for highlighting the crucial role of behavioral modification in managing obesity and metabolic